Hello, today my college on the will be presenting on the topic of treatment of pressure ulcers in breathing patterns. Hello, today
Con
my
las líderes
college
Lisandra
on the
Moreno
will
Coronado
be
y Karen
presenting
Lucía
on the
Valencia Ruiz.
topic of
For the index, we'll have the following points. The first one will be the objective, the introduction, the treatment of pressure ulcer in a treating patient, the definition of the procedure, the nursing fundamentals, the equipment, the materials we need, the script, the conclusion, and finally the references.
Introduction. Pressure user, also known as vector, are skin issues scarred by prolonged pressure or sentence for on the body, especially in breathing of immobile pattient. This word commonly appears on areas such on the hips, and lower back.
To define, well, the objectives we have are the following ones. And the first one will be to define the procedure for the treatment of pressure ulcers of a breathing patient, identify its purpose, indications, and steps according to nursing care standards. Also, to describe the nursing fundamentals involved in the management of pressure ulcers, emphasizing the infection prevention, patient comfort, and promotion of tissue healing. Also, to identify and list the equipment and materials required for the treatment of pressure ulcers, ensuring their correct selection, preparation, and maintenance for safe and effective patient care. We also have to apply nursing techniques appropriately during the treatment of pressure ulcers, following aseptic principles and evidence-based practice to reduce complications. And finally, we'll evaluate evaluate the effectiveness of treatment through observation of wound healing progress and documentation in the patient's clinical record.
treatment of pressure ulcer in a breathing patient.
Well, we have the definition of the procedure, which is the pressure ulcer dressing is a nursing procedure that involves cleaning, disinfecting, assessing, and protecting a wound caused by a prolonged pressure of the skin and underlying tissue. Its main purpose is to promote healing, prevent infection, and relieve the patient's discomfort. During this procedure, the nurse evaluates the wound, removes the previous dressing, cleans the area with a sterile solution, applies the proper topical treatments of dressing, and documents the wound's condition. Also, the nurse provides education to the patient for the patient or the family members about the importance of regular position change, proper hygiene, and good nutrition to help prevent new infections. Which of the positions of the most common ulcer, the pressure ulcer are the occiput, which is in the back of the head, the scapula on the shoulder blades, the elbows, the sacrum and coccyx, which is I think it's the most common pressures of also pressures. Also, we have the heels, the ankle and knees, the hips, and the ears and the shoulders.
Risk assessment. Regularly assess mobility, sensation, nutritional status, incontinence, moisture frequency. The factor directly influence the risk of developing pressure ulcers. Use risk assessment tools such as the braid scale to identify parents and high risk.
For the following fundamentals, we have the prevention through skincare and pressure relief. We have to keep the skin clear, dry, and free from excessive moisture. Avoid irritants and use barrier creams when needed. Usually, these are used for prevention, right? So, keeping the skin clean and dry will prevent from microorganisms to live around the area. Also, the reposition the patient frequently to reduce pressure on bony prominences, generally every 2 hours for pregnant patients. So usually or frequently, the nurses for each turn, at least they have to do two two. How can I say it? Sorry, I forgot. But the at least two position changes every turn. Also, we have the nutrition, hydration, and tissue support factors. My head gets in the way a little bit, uh, s- but also ensure adequate protein, vitamins, and mineral intake, and maintain proper hydration to preserve the skin integrity and promote healing. Also, monitor nutritional status since poor nutrition increases the risk of ulcers and delays wound healing.
Education in interdisciplinary collaboration. Education the parents, family members, and healthcare staff of prevention measure position change, skin hygiene, and nutrition. Documentation and monitoring. Systemic quality record and assessment, intervention, repositioning, schedule, skin condition, and any now or healthy pressure user. This allow evaluation of the effectiveness.
For the equipment we need, or the materials we need for the procedure, we will have to use a hand sanitizer or soap and water. Uh, for preferences, we use soap and water. Also, gloves and mask, a sterile dressing tray or sterile field, sterile gas guys and forceps, natural saline solution, sterile dressing and adhesive tape, waste disposal bag, and a documentation sheet.
Treatment of pressure ulcer in the bridden pattern. Treatment of
My
pressure
partner and
ulcer
I are
in
not in
the
the same
bridden
location
pattern.
while recording our
Treatment
parts,
of
so
pressure
that's why
ulcer
there might
in the
be a
bridden
slight
pattern.
delay in our
Treatment
answers
of
during the
pressure
script.
ulcer
So
in
please
the bridden
take this into
pattern.
consideration regarding
Treatment
the way we
of
record.
pressure
Thank you.
ulcer in the
For the following script, we'll use the personal introduction and a patient identification. I'm going to be the nurse, and my classmate will be the patient. Good morning. My name is Lucia, and I'll be your nurse today. Can you please confirm your full name and date of birth, please?
My name is Maria del Socorro Torres, and my birthday is June 17, 1980.
Thank you. Do you have any allergies I should know about?
I
For
am
the
not
following
allergic
script,
to any
we'll use
medication.
the personal. For the second part, I'm going to do the explanation of the procedure and consent of the patient. I'm going to clean and change the dressing of your pressure ulcer located on the back of your right lower extremity. The procedure includes cleaning the wound, checking its condition, and applying a new dressing. May I begin? Please let me know if you feel any pain or discomfort.
Yes, go ahead.
For the third part will be the preparation. I'll wash my hands, put on gloves, and prepare the materials, sterile gauze, saline solution, forceps, and a cleaning dressing. I will be simulating the preparation. And for the fourth part, we'll have the procedure with pauses. I'll carefully remove the old dressing.
Okay, nurse.
Now, I'll clean the wound from the center outwards with the sterile gauze and saline solution. The wound is reddish with a little exudate and healthy new tissue.
So my word is prevailing.
Yes, it's healing very well, Maria del Socorro. I apply the new dressing and secure it carefully. I'll still simulate the application. And for the last point, we'll have the patient education and closing. Alright, I'll come back to change your dressing every 24 hours. Please keep your skin clean and dry. And let us know if you notice any signs of infection, such as fever or an unusual odor. I'll document today's procedure and return for your next dressing change. How are you feeling?
I feel very well, nurse. I am glad my ulcer is healing well. Thank you very much.
Very well. Thank you, Maria del Socorro. I'll take off my gloves and wash my hands again. And last but not least, we have the conclusion, which is the proper care and dressing of pressure ulcers are essential nursing procedures that promote wound healing, prevent infections, and improve the patient's comfort and quality of life by following correct hygiene, using sterile materials, and providing education about skincare and position changes. The nurse play is a key role in preventing complications. Sorry, and supporting the patient's recovery. We have the references that we used here. That would be all for us, and thank you for listening. And have a good day.